Hi, I'm Jody Wishart. On behalf of Scholastic Corporate Benefits, welcome to Open Enrollment 2015, Taking Charge Made Easy. You should have already received your Quick Start Guide, which contains the information you'll need to make your benefit elections for 2015. Please feel free to refer to it during this presentation. For those who did not receive a printed Quick Start Guide, you can find it online at access.scholastic.com. During the presentation, we'll show you how you can access all of your open enrollment material online. We'll also go over the changes to the Scholastic Health Plans and your benefit options for the 2015 plan year. We'll introduce you to the new UHC tab on the My Benefits homepage and to the new Care Advocacy Program, which can help you manage your chronic or complex healthcare needs. We'll talk to you about the importance of keeping your contact information up to date in case there's an emergency, and we'll show you how you can get your flu shots for free again this year. Next, we'll review the actions you need to take during open enrollment and tell you how you can enroll in your benefits. We'll also provide you with the contact information for the Scholastic Benefits Service Center. They are there to help answer any of your enrollment questions. Your 2015 benefit options include a choice between two United Healthcare account-based health plans. One is the UHC Choice EPO plan with Health Reimbursement Account, or HRA. The other is the UHC Choice Plus POS plan with Health Savings Account, or HSA. Most aspects of these plans will be very familiar to you already, and we will discuss them in more detail during the presentation. We will continue to use Express Scripts for the prescription drug benefit, and VSP will still be our provider for vision coverage. There are no changes to either of these benefit programs for 2015. We also have a new dental provider. Cigna Dental will be replacing MetLife Dental. For flexible spending accounts, we still have the Healthcare FSA, the Dependent Care FSA, and new for 2015, we will be offering a limited purpose FSA. This new FSA is only for those who are enrolled in the UHC POS plan with a health savings account. More on that coming up later in the presentation. Plus, you can elect extra supplemental life and disability coverage during open enrollment. You can also enroll in or opt out of the Met Law Legal Plan. And we're very pleased to announce a new benefit offering for 2015, Mortgage Masters. They'll provide personalized lending solutions and free, no-obligation consultations for your residential financing needs. All of the open enrollment materials that we are going to discuss during this presentation can be found online, all in one place. Just log on to access.scholastic.com. Click on the My Benefits link, and then on the Resources tab in the green bar at the top of the page and scroll down to the Open Enrollment section. You'll find everything online that you will need to make your open enrollment choices, including the 2015 benefit guides, the open enrollment video, and all of the supporting material listed here. You may make your benefit elections for the 2015 plan year anytime until 6 p.m. Eastern Time on November 7, 2014. If you currently have medical coverage through Scholastic, you must do one of two things. You must pick a plan for 2015, or you can waive coverage. Otherwise, if you don't actively enroll in a medical plan or waive coverage, you will automatically be placed in the UHC Choice EPO plan with HRA, even if you currently have the POS plan. If you don't currently have medical coverage through Scholastic, and you prefer not to enroll in a plan for 2015, you don't need to take any action. However, be aware, if you don't have health insurance in 2015, you may be subject to a penalty. Visit healthcare.gov for more information about the individual mandate. Keep in mind, the benefits you select during open enrollment will remain in effect from January 1, 2015 through December 31, 2015. You cannot change your benefits during the plan year unless you have a qualified status change. Please refer to the full version online benefits guide for details. Employee Plus is a term that you will hear quite a bit during open enrollment. It refers to any coverage level that includes more than employee only, such as employee plus spouse or same-sex domestic partner, employee plus child, or employee plus family. The Employee Plus term is important because it can help you understand how much money you can earn in a single year for your HRA or HSA through incentive dollars. For example, if you have employee plus spouse or same-sex domestic partner or employee plus family coverage with spouse, you will qualify for all of the available incentives for a total of $1,300, provided that both you and your spouse or partner complete the incentive requirements. However, if you have employee plus child or employee plus family coverage without a spouse, you can only earn up to $800 in incentives. That is because children cannot participate in the wellness activities to earn additional incentive dollars. Also, as we go forward in this presentation, it is very important to understand that if you choose the POS plan with HSA, the entire Employee Plus deductible must be met before anyone in the plan is covered by coinsurance, and you will have to reach the entire Employee Plus out-of-pocket maximum before the plan will cover you or your dependents at 100%. Let's start with your options for picking a medical plan. First, UHC will continue to be our healthcare provider for the 2015 plan year. You have the option of choosing between two plans, the UHC Choice EPO with HRA or the UHC Choice Plus POS with HSA. Some of the aspects of these plans are already familiar to you. For example, the UHC Choice EPO plan offers in-network coverage only. That means if you pick this plan, all of your healthcare services such as office visits to your primary care physician or specialist, as well as hospital care, must be scheduled with providers who are in the UHC Choice network to be covered. Before choosing a plan, log on to myuhc.com or scholastic.welcometouhc.com to make sure the providers you are using are in the network. In the EPO plan, you don't need to meet a deductible to see your primary care physician for non-preventive care. You just pay a $25 copay. For most other services, once you meet the deductible, you will be covered at 80% of the cost of your care. You'll be responsible for the remaining 20%. For more details specific to the EPO plan, please refer to the plan highlights on page 1 of your Quick Start Guide. The UHC Choice Plus POS plan gives you the flexibility of choosing doctors, specialists, and hospitals that are both in and out of network. In this plan, you must meet the deductible for all services, including the cost of prescription medication, before the plan will begin to pay coinsurance benefits. New for 2015, your prescriptions will also be subject to the deductible. However, once you satisfy the deductible, the plan pays 80% for additional claims and you pay the remaining 20%. Also new for 2015, if you choose the POS plan for Employee Plus coverage, be aware that your coverage group must satisfy the entire $3,000 deductible before anyone on the plan can be covered by coinsurance. This stipulation also applies to the $12,700 in-network out-of-pocket maximum. Keep in mind the deductible and out-of-pocket maximums are higher for out-of-network coverage. Refer to the Quick Start Guide for details on these amounts. As always, preventive care is covered at 100% in both plans. Please be aware that even if you choose the UHC POS plan, preventive care services must be received in-network to be covered. This year, there are some new aspects of the medical plan that you need to become better acquainted with. They are the Health Reimbursement Account, or HRA, and the Health Savings Account, or HSA. The UHC EPO plan comes with a Health Reimbursement Account, or HRA. You can use the money in your HRA to reimburse yourself for any qualified medical expenses throughout the year. The money in the HRA is owned and funded by Scholastic, so you can't take it with you if you switch health plans or should you leave or retire from Scholastic. But you can use the money to pay for any of your qualified medical expenses, like copays for PCP visits, prescription medication, and other services that count toward your deductible. In fact, as long as you have money in your HRA, you don't have to pay anything out of pocket for your medical care. And if you have any money left over at the end of the year, it will automatically roll over to the following year as long as you remain in the EPO plan. However, once you use up all the money in your HRA, you'll be responsible for any other medical expenses you incur. So, as you can see, the more money you have in your HRA, the less you will have to pay out of pocket on medical expenses during the year. We'll explain how to put money into your HRA coming up soon, but right now let's take a look at the Health Savings Account, or HSA option. The UHC Choice Plus plan comes with a Health Savings Account, or HSA. A health savings account is a personal bank account that you own and control. You own all of the money in your HSA, even the money Scholastic contributes to your account. Once the money is in your account, it's yours. You can take this money with you even if you change health plans or if you leave or retire from Scholastic. You can use the money in your HSA to pay for any qualified medical expenses that count toward your deductible, such as doctor visits and prescriptions. Or you can pay out of pocket for your health care and save your HSA dollars for future use, even into retirement. Plus, if you have any money left over at the end of the year, it will stay in your personal account until you decide to use it. But keep in mind, this money can only be used for qualified health care expenses. Be aware, not everyone can enroll in the HSA. Please be sure to review the eligibility requirements on page 9 of your benefit guide for details. So, how do you get all this money into your HRA or HSA? Simple. There are 3 basic ways to put money into your account. First, pick a plan. When you enroll in a Scholastic medical plan, Scholastic will deposit money into your HRA or HSA. You will receive $150 for employee-only coverage and $300 for any other coverage level. This money will be available for you to use on January 1st, 2015. Next, take the health assessment. When you take the health assessment, you will receive $150 in your HRA or HSA. When your spouse or same-sex domestic partner takes the health assessment, you'll get another $150 in your account, for a total of $300 just for taking your health assessment. Now, you're able to earn up to $350 more for your HRA or HSA by participating in any of the wellness activities listed here. If your spouse or same-sex domestic partner does them too, you can add another $350 to your account, giving you a total of $700 just for participating in qualified wellness activities. A few things to note about the health assessment and wellness incentives. You will have to take the health assessment to qualify for any other wellness incentive. To get the health assessment incentive, you and your spouse or same-sex domestic partner must provide valid biometric health screening information from a doctor, on-site wellness center, or on-site screening event on the health assessment. Only employees and spouses or same-sex domestic partners who are enrolled in a Scholastic medical plan can earn the health assessment and wellness incentive credits. Children do not qualify for the health assessment or wellness incentive credits. You don't have to take the health assessment by the end of open enrollment. In fact, the health assessment will remain open until September 30th, 2015 for this incentive period. So you and your spouse or partner have plenty of time to get your health screening done. Plus, you don't have to earn the incentives in order. You can get your wellness exams, visit the dentist and eye doctor, or complete a coaching program anytime from October 1st, 2014 through September 30th, 2015 for your 2015 incentives, even if you do your health assessment later in the year. However, the incentive credits won't be deposited into your HRA or HSA until you complete the health assessment. It all adds up. Enroll in a Scholastic medical plan and get $150 employee only or $300 employee plus. Take the health assessment with biometric health screening results to get $150 employee only or $300 employee plus spouse or same-sex domestic partner. Participate in wellness activities to get up to $350 employee only or $700 employee and spouse or same-sex domestic partner. Do all of these things and you could end up with $650 for employee only or from $800 to $1,300 for employee plus that you can use for qualified medical expenses. And the quicker you act to earn the incentives, the sooner the money will be deposited into your account for you to use. If you elect the UHC Choice Plus POS with HSA, you have even more options to put money into your account. You can add your own money up to the maximum contribution limit set by the IRS for 2015. If you're 55 or older, you can add up to $1,000 a year extra to your HSA above the IRS limit. Plus, the HSA is triple tax-free. You pay no federal income tax on the deposits you make to your HSA. There are no taxes on the money you withdraw from your HSA for qualified medical expenses. Plus, any interest you earn on the money in your HSA is also tax-free. Remember, all of the money in your HSA is yours, even the funds contributed by Scholastic. You decide if you want to use the money in your HSA to pay for your healthcare expenses now or in the future. It's up to you. So how does it all work? Well, first of all, your preventive care visits are covered at 100% in-network, so your out-of-pocket cost for that is already $0. With the EPO plan, there is a $25 copay to see your primary care physician for non-preventive care, like when you get the flu or the kids have an ear infection. But you can use the money in your HRA to cover that expense, so your out-of-pocket cost is still $0. Say you have to see a specialist or you need physical therapy. You haven't met the $750 or $1,500 deductible yet, so you have to pay the full cost for the visit, which in this case is $160. But once again, you have money in your HRA, you pay $0 out of pocket. Plus, you need a prescription. You've chosen the generic, so your copay is $8, because in the EPO plan you don't have to meet the deductible before your prescriptions are covered. But because of your HRA, you still don't have to pay anything out of pocket. In fact, as long as you have money in your account, you don't have to pay anything out of pocket for your medical expenses. It's only after the money in your HRA runs out that you'll be responsible for the bill. This will also help make you a better consumer of healthcare services. By deciding to ask your doctor for a generic medication or by comparing prices for medical tests and services, you'll be able to stretch your HRA dollars. Plus, UHC automatically processes your claims and pays them with the money in your HRA. Log on to myuhc.com to monitor your HRA expenditures and the status of your medical claims. It couldn't be any easier. Please note that for any healthcare you receive under these plans, you are paying the Scholastic contracted rate for these services. This is a negotiated rate that is lower than what you would pay if you weren't covered under these plans. Next, let's meet the Carters for a real-life example of how the EPO plan with HRA can work for you. The Carters, mom, dad, and 2 kids, have the UHC Choice EPO plan with HRA. Their preventive care is covered at 100%, so they didn't have to pay anything out of pocket for everyone's annual checkup and wellness exams. That came to almost $2,000 in healthcare services paid for by their health plan. But the kids got sick a couple of times during the year, and then Ron had to have outpatient surgery, which included several physical therapy sessions and pain medication for his recovery. Altogether, the total cost of their medical care came to almost $4,000 for the year. So first, they had to meet their $1,500 deductible. After that, they had to pay 20% for their medical care for the rest of the year, which came to $495. They also paid $16 in prescription copays. So the total amount they owed for the year came to just over $2,000. Luckily, the Carters had $1,300 in their HRA, which they used to bring their total out-of-pocket cost down to $711. And there was no paperwork. Because they have an HRA, UHC processed the Carters' medical claims as they came in throughout the year. So any money in their HRA automatically went to pay their claims even before they met their deductible. And that's how you can make the account-based plans work for you. The exact same healthcare services would have cost them almost $2,000 if they had the UHC POS plan, even after using the money from their HSA. That's because no one on the plan would have been covered by coinsurance until they paid $3,000 for the deductible, which included both their medical care and their prescription medications. The UHC Choice Plus POS comes with a Health Savings Account, or HSA, which you can use for any qualified medical expenses you incur throughout the year. Just like the EPO plan, preventive care is covered at 100% as long as the services provided are in-network, so you pay $0 out of pocket. Next, you see your primary care physician and the visit costs $100. You haven't met your deductible yet, so normally you would have to pay $100 out of pocket. But now you can use the money in your HSA to pay that expense and your out-of-pocket cost is $0. Plus, the $100 you paid for your visit goes towards your deductible. It's the same thing if you visit a specialist. Say the cost of the visit is $250. You still haven't met your deductible. If you have money in your HSA, you can use it to pay this bill as well. The cost of the visit goes toward your deductible, and you've still paid $0 out of pocket. Now you need to fill a prescription. The script cost is $60. In the POS plan, you have to pay the full cost of your prescription until your deductible is met. But because you still have money left in your HSA, you pay nothing out of pocket, and the cost of the medication goes towards meeting your deductible. Keep in mind that you are paying the Scholastic contracted rate for these services, so what you pay is lower than if you weren't covered under these plans. And with the HSA, the choice is yours. You decide if you want UHC to automatically pay your claims using your HSA, or if you prefer to pay your medical expenses out of pocket and let your HSA grow. After all, you may want to build up the money in your HSA for future medical expenses, like having a baby, or if you know you're going to need surgery for an upcoming knee replacement. You may even want to save it up for retirement and use it to supplement your Medicare coinsurance costs. And keeping track of the money in your HSA is as simple as logging on to myuhc.com. Any way you look at it, it pays to have money in your HSA. To see how the POS plan with a health savings account can work for you, let's meet Ty, an overall healthy guy. Ty keeps in shape, monitors his health by going for his annual physical, and generally takes really good care of himself. Ty has the UHC POS plan with an HSA. His preventive care visits are covered at 100% in-network, so most of the time he doesn't have any out-of-pocket medical expenses. But when he got sick last month, his medical costs for his doctor visit and prescription medication came to $135. But Ty was able to use the money from his HSA for those expenses, so he still didn't have to pay anything out of pocket this year. Granted, he would have paid less in the EPO plan because his doctor visit for non-preventive care would have cost him only $25 for his copay, and his generic prescriptions would have been $8 for a total of $33 in healthcare expenses for the year. But Ty decided that the POS plan with HSA was best for him because he won't use up all the money in his health savings account during the year, so he can let his account grow. Plus, he can add his own money to it if he wants, and he's paying $173 less during the year for his medical contributions. The POS plan with HSA works really well for Ty, but before you pick a plan, you have to know your risks. Stop! Know your financial risk before enrolling in a medical plan. Even if you receive the $150 or $300 automatic deposit for enrolling and all incentive money available to you, your financial risk is greater if you enroll in the UHC Choice Plus POS plan with HSA. That's because your effective deductible is higher under the POS HSA plan. What is an effective deductible? It is the amount of your deductible after applying the money from your HRA or HSA. In the EPO plan, your deductible without the incentives is $750 for employee coverage and $1,500 for all other coverage levels. After you apply the enrollment and wellness incentives worth $650 for employee only and up to $1,300 for employee plus, your effective deductible can drop dramatically to only $100 to $200 depending on your coverage level. This also applies to the out-of-pocket maximums shown here. However, in the POS HSA plan, your in-network deductible is $1,500 for employee-only coverage and $3,000 for all other coverage levels. Even when you apply money from your HRA or HSA, your deductible is still $850 employee-only and between $1,700 and $2,200 for employee plus coverage. That is considerably higher than the $100 to $200 effective deductible under the EPO HRA plan. Keep in mind that for any coverage level, except for employee only, your coverage group must satisfy the entire $3,000 deductible before the plan pays for any health care expenses for anyone covered on this plan. This is also true for the in-network out-of-pocket maximums shown here. Deductibles and out-of-pocket maximums for out-of-network coverage are substantially higher. Refer to pages 13 and 14 of the Quick Start Guide for details. Be sure you can assume these financial risks before you enroll in the POS HSA medical plan. Please note that the amount of the effective deductible assumes that all of the incentive money available has been applied to the deductible. If you don't take advantage of the incentive opportunities available to you, you will be responsible for the full deductible and out-of-pocket costs. Also, for employee and child or employee and children coverage levels, the effective deductible is higher. That is because only the employee can take the health assessment and earn incentives. Please refer to the effective deductible pullout in your Quick Start Guide. When making your decisions about which plan is better for you, be sure to review the medical comparison chart on pages 13 and 14 of your Quick Start Guide. By looking at the medical comparison chart, you can see that for the most part, the benefits themselves remain pretty much the same. And remember, for any health care you receive under these plans, you are paying the Scholastic contracted rate for these services. In addition, your medical contribution rates may increase or decrease depending on which plan you choose and on your salary band. The only other benefit that will see a slight rate change is the VSP plan. All other benefit plan costs remain the same. As mentioned before, Even though the biweekly contribution rates may be lower for the POS plan, be sure you can assume the financial risk associated with the higher deductible and out-of-pocket maximums in the POS plan before you enroll. Flexible spending accounts, or FSAs, are a great way to manage your healthcare costs while saving you money on taxes. Money deposited into your FSAs is tax-free when you use it for eligible healthcare expenses. Plus, your pre-tax contributions lower the overall amount you pay on your income tax each year. If you want to participate in a flexible spending account, you must enroll or re-enroll each year. This benefit does not carry over from one plan year to the next. Plus, you must use all of the money from your 2015 FSA by March 15, 2016. Any money left over in your account after that date will be forfeited. Remember, you don't have to be enrolled in any other benefit to participate in flexible spending. This year, you have 3 FSAs to choose from: the Healthcare FSA, the Dependent Care FSA, and the new Limited Purpose FSA. The Healthcare FSA can be used to pay for any eligible out-of-pocket medical expenses, such as co-pays or coinsurance for your healthcare. You can contribute up to $2,500 into your Healthcare FSA. If you have any money in your HRA, the plan will automatically pay for your medical care from this account. Should you use up all of the money in your HRA, then the plan will draw from your Healthcare FSA. Depending on the amount of money in each account, it's possible that you wouldn't have to pay any out-of-pocket medical expenses during the year. You can enroll in the Healthcare FSA if you choose the UHC EPO plan with HRA. If you enroll in the UHC POS plan with HSA, you are not eligible for this FSA. The Dependent Care FSA can be used for eligible non-medical expenses such as childcare, preschool, and before and after school care. You could contribute up to $5,000 pre-taxed into this account. You can enroll in either UHC plan offering and still participate in the Dependent Care FSA. And finally, there's the Limited Purpose FSA. This is new for the 2015 plan year. If you have the UHC POS plan with HSA, this flexible spending account is for you. The Limited Purpose FSA allows you to set aside pre-tax dollars for your eligible dental and vision expenses only. You can contribute up to $2,500 in your Limited Purpose FSA for 2015. But just like any other flexible spending account, you must use up any money in this FSA by March 15th of the following year. So calculate the amount of money you plan to set aside for these expenses carefully. See page 10 of the Quick Start Guide for more information. New, your 2015 flexible spending accounts will be managed by United Healthcare. So starting in January, you can log on to myuhc.com to check the status of your 2015 FSA claims as well as your FSA balances. Visit the new UHC tab for more information. Please keep in mind, however, that the Benefits Service Center will continue to handle all of your 2014 FSA claims, including any claims made through March 15, 2015, for any unused 2014 amounts. Click on the Current FSA tab on the My Benefits page at access.scholastic.com to track your current flexible spending account. There's a new addition to the My Benefits site, the UHC tab. You'll have a number of options to choose from. Click on Welcome to UHC.com for information about the new account-based medical plans, the new Limited Purpose FSA, videos about the HRA and HSA, and to see if your provider is in-network. Still not sure which UHC plan is right for you? Click on the Plan Cost Estimator to get a customized estimate based on the healthcare expenses you may incur of just how much each plan will cost you for the year. Want to become a savvy healthcare consumer? Click on My Healthcare Cost Estimator to compare prices and provider ratings for tests and medical services in your area so that you can get the best care possible without overpaying. Remember, the less you spend, the more money you'll have in your HRA or HSA. Plus, in 2015, you'll be able to log on to myuhc.com to manage all of your HRA, HSA, and FSA funds. Coming in January 2015 from United Healthcare, the Care Advocacy Program. This program includes a team of experienced nurses who offer support if you have health conditions that require complex care, or if you recently received care at a hospital. For example, you may hear from a nurse if you were recently diagnosed with a complex medical condition, or if you're expecting a new baby. The Care Advocacy Program will also be your place for condition management coaching for chronic conditions such as diabetes, coronary artery disease, or asthma. The nurse will help you stay on track with the treatment program recommended by your doctor. Plus, each time you or someone in your family needs support, you will be able to talk with the same nurse. So now you'll have a nurse in the family. If you use tobacco products, you will pay an additional $10 per pay period toward your 2015 medical contributions. However, you can eliminate this extra charge by completing a smoking cessation program. We know it's tough to do, but you don't have to go it alone. If you need help, you can enroll in a lifestyle health coaching program to help you kick the habit. Not only will you get a dedicated health coach to guide you through your tobacco cessation program, but you'll also receive $100 for your HRA or HSA when you complete the program. Refer to page 12 of your benefit guide for more information about the Wellness Incentive Program. Need more help to quit tobacco? Now you can also take advantage of the enhanced smoking cessation benefits that are available to you. The plan covers certain smoking cessation prescriptions as well as nicotine replacement therapy products at no additional cost to you. Plus, we've eliminated the $1,000 lifetime maximum limit. Contact Express Scripts for more information. Please note you can find these phone numbers as well as contact information for all of our benefit plan providers on the benefit contact magnet that came along with your benefit guide or online at access.scholastic.com. Same great coverage, different name. Effective January 1st, 2015, Cigna will replace MetLife as our dental plan provider. For plan details, please refer to the Cigna Dental Summary Plan description online at access.scholastic.com. To find out if your dentist is in-network or if you have any other questions about Cigna Dental, visit them online at mycigna.com. You can also find their contact information on the dental plan card inside your benefit guide. If you didn't receive a benefits guide, you can download and print a dental card from the resources page. Please note that the dental card is for your reference only. You do not need the Cigna dental card to receive services. And don't forget, you can receive $50 for your HRA or HSA when you go for your annual dental checkup. Spouses are also eligible for this wellness incentive. Important: check to see if your dentist is in-network before you enroll in the PPO Advantage plan. If not, out-of-area coverage is also available. For plan details, please refer to the Cigna Dental Summary Plan description online at access.scholastic.com. Click on the My Benefits link and then on the Resources tab. Mortgage Masters, Inc., MMI, offers free, no-obligation consultation and pre-approvals to all Scholastic employees preparing to make a real estate purchase or to refinance a home. Their personalized lending solution and low-cost options will give you choices that allow you to achieve your financial objectives and to realize your dream of home ownership. MMI works with over 60 investors to offer a wide variety of mortgage options and competitive rates to accommodate your personal home financing needs. Be sure, be safe. Update your personal contact information today. In the event of a natural disaster or unexpected event, our emergency notification system will send you an alert by phone, email, or text, your preference. Be sure we have your current home phone, cell phone, and personal email address on file. Log on to access.scholastic.com and click on Workday. Then add or change your contact information by clicking on the personal information icon. Our benefit plan providers are always here to help you. Whether you have a question about your current benefits or you need to follow up on a claim, or you're just trying to locate a provider in your area, feel free to contact any of the plan providers listed here. This information can also be found on the Benefits Contact Info magnet provided with your benefit guide. Please post the magnet in a place where you'll always have easy access to these helpful phone numbers and websites. If you didn't receive a printed benefit guide, the magnet will be mailed to you with your benefit confirmation statement in December. Take aim against the flu again this year by getting a free flu shot. If you work in Soho and Jefferson City, no flu shot vouchers are needed. Simply contact your on-site wellness center to make an appointment to receive your free seasonal flu shot, and you're all set. If you work in a location that doesn't have an on-site wellness center, take the flu shot voucher that's tucked inside the back cover of your benefits guide to a local Walgreens to receive your free flu shot. If you didn't receive a printed benefit guide, just log on to access.scholastic.com, go to the resources page, Scroll down to the Open Enrollment section to download and print the Walgreens flu shot voucher. So what do you need to do during Open Enrollment? After this Open Enrollment meeting, be sure to review your 2015 benefit guide and compare your plan options. Then, pick a plan. Just for enrolling in a Scholastic medical plan, Scholastic will deposit $150 for employee-only coverage and $300 for Employee Plus coverage into your HRA or HSA. Remember, if you don't actively choose a health plan for 2015, you will automatically be enrolled in the UHC EPO plan with HRA. So pick a plan. It's the only way to make sure you get the coverage that you want. Don't forget, when you take the health assessment, you'll receive another $150 into your HRA or HSA. Plus, if your spouse or same-sex domestic partner takes the health assessment, you'll get $150 more for your HRA or HSA. Remember, biometric health screenings are required on the health assessment to receive this incentive. Also remember, if you want to participate in flexible spending in 2015, you must enroll or re-enroll during Open Enrollment. This benefit will not automatically carry over into the next plan year. This includes the new limited purpose FSA for those who enroll in the POS plan with HSA. Open Enrollment is also the time to review or change your supplemental life insurance coverage. See the benefit guide for details. Check your 401k contribution level. Every year on October 1st, your contribution level increases by 1% because of the Annual Increase Program, or AIP. For more information about the AIP, please refer to page 16 of your benefits guide. Open Enrollment is the only time that you can enroll in or opt out of the Met Law legal plan. Contact 1-800-GET-MET-8 for details. An Open Enrollment checklist is also available on page 2 of your Quick Start guide. To enroll in or change your benefits for 2015, log on to access.scholastic.com. Click on the My Benefits link and then Open Enrollment. Remember, you must provide a phone number to enroll in benefits. This is a required field. You won't be able to click to the next page until you enter a phone number on the My Information page. To enroll online, refer to the How to Enroll in Benefits step-by-step guide included in the back pocket of your benefit guide. Don't have access to a computer? Contact the Scholastic Benefit Service Center at 1-888-4-MY-BENF to speak to a customer service representative. The Scholastic Benefit Service Center is there when you need them. Whether you need to ask them a question about your current benefits or if you need help when you enroll, you can reach them by phone Monday through Friday, 10 a.m. to 7 p.m. Eastern Time. The online services listed here are available to you 24 hours a day, 7 days a week at access.scholastic.com. Just click on the My Benefits link to find what you need. Remember, the Resources tab is where you can find all of your 2015 benefits information, including the Quick Start version and full version of the benefits guides, the summary plan description and summary of benefit and coverage documents, as well as the summary annual notices. Everything is just a click away. This concludes our 2015 Open Enrollment presentation. On behalf of Scholastic Corporate Benefits, thank you for attending this Open Enrollment WebEx session.